Good day, I'm Sadini Gunasinghe from Group 25 and today I'm going to demonstrate skills of caring for a bariatric patient. Bariatric patients are patients who are normally overweight or morbidly obese. They have a higher BMI, therefore, normal daily activities such as walking, standing are difficult for them. So, you have to be sensitive and keep that in mind while dealing with these patients. Discrimination is a huge problem with bariatric patients, and normally they feel very ashamed or embarrassed when they are in the hospital, as they share the frustrations of care that the healthcare provider also feels. So, it's very important to make sure that they feel at ease as possible in all the time. Avoid assuming that bariatric patients are just larger versions of normal adults. They come with many comorbidities most of the time, so it's important to keep all this in mind when caring of them. Check on their vitals usually to make sure their breathing rate and respiration rates are normal. Give them oxygen if is needed. Most bariatric patients require oxygen and make sure that they get the proper nutrition as well. It's important to anticipate the medical patient's care needs in advance so that you can get the required materials that may be necessarily stocked in your unit. So this includes thigh-sized cuffs for the taking blood pressure and large wheelchairs, larger hospital gowns and other things that may be support bathing the patient or cleaning them regularly. Most bariatric patients require specialized equipment and hospital furniture. So it's your responsibility to make sure that these are available for those patients. So this includes a bed that can fully support the weight of the patient and also it is safe for the patient. Bedside chairs that are in the bariatric patient's room should also be big enough to fit the patient as well as any visitors that may also be large. Regular hospital gowns will not fit for the bariatric patients, so getting a hospital gown that fits them is also very important. If you cannot get one, you can use two hospital gowns, like one gown from front and other one joins to the first one from back. However, this is embarrassing for the patient, so this must be avoided at all cost. When transferring bariatric patients, always get extra help as these patients are heavy. There are many devices now that make transferring bariatric patients easier for the testing assistant. One of these devices includes the hover mat, which curve around the patient, making them feel very comfortable, and it will be easier to lift and ambulate the patient without any trouble. Sleep care is also very important for the bariatric patients as they have lots of extra skin and skin folds, so it's important to keep the skin dry after you clean it between the folds and everything, and we must make sure that the skin is not weeping, which means it's over moist. Be very gentle with them as the skin may be all stretched and their skin is very sensitive to moisture and pressure. Using a pressure cushion may also help them. Patients will be seated on their buttocks for extended periods of time, so this cushion will help with the procedure. Additionally, the devices such as the bariatric heel float, which eliminates the pressure placed from the heels when lying down and prevents special looses from forming on those areas where bariatric patients often sweat profusely and feel short of breath due to the weight of the chest. This can be prevented and improved by improving ventilation in the room by installing a fan. For elimination of the bariatric patients, they may usually be catheterized, and indwelling catheter is better for these patients as a quantum catheter might be difficult to place in an obvious male patient. For perineal cares, sideline positions are easier than the patient lying on the back due to the patient's refuse to invest ask for help with normal daily life activities. However, they do need assistance for these because some patients are too large to even conduct activities for their own personal hygiene. So, this may be something that you should keep in your mind and do during your shift multiple times. Might be checking in between the skin folds, cleaning them regularly. So, these are things you must keep in mind because your patient may be too embarrassed to come to you and ask for these things.